talked about earlier, as I talked about earlier, we are trying to have a focus on what to do as a runner, and now trying to shift the focus as to what to do as a runner in the time of COVID. I think that Dr. Kim did a very good job of setting the stage for the cardiac piece of the return to play and the running and those concerns. And what I hope to do in my presentation is to give a little bit of the continue along that with some more practical interpretations and review of the USATF guidelines for putting on and getting back, not so much getting back to running, but putting on running events for those of you who are being involved with that, getting a good understanding of what is allowable, what isn't allowable, and what you need to be thinking about as you go and do that planning. So with that, I am going to turn to and share my screen and get started with my presentation. Okay, good morning. Good morning, everybody. Again, I'm Amadeus Mason. I'm the co-director for the Running Medicine Program, and today in the next 5-10 minutes, I wanted to go through the USATF guidelines on how to go about, or what are the things you need to be thinking about for getting a running event off the ground. My disclosures aren't relevant. There's no relevant disclosures here. One thing I would say is that I am a member of the COVID panel that has helped to produce some of these USATF guidelines. So what are the guiding principles that we think about as we came up with these guidelines? The first thing is key: listening to the local health departments and CDC. That was part of what Dr. Kim closed on in his presentation about, you know what, you need to listen to the local authorities, the healthcare providers that are in public health, because as much as this is a impacting our sport and what we'd like to do, it is still a public health issue. And the CDC and the Public Health Department will be our guide there. And for us, stratification of risk is a key. When we talk about being able to put on events and being able to compete and being able to do things like that in the time of COVID, there is not anything that will eliminate risk. It's about a stratification of risk. And based on that risk stratification, what would be allowed or what should be allowed and what precautions should or should not be taken. And then finally, the way we thought about things was using a staged or phased approach to how you would go into competition and doing things of that nature. So it's kind of, again, piggybacking or continuing along Dr. Kim's recommendation of, you don't just go straight into or return back to your activities. You gotta do a phased or stage-wise approach in getting back to your activities. So where do you go to for this information to begin with? I think that's a great place to start. This is the USATF website. Prominently on the landing page is the link that takes you to the COVID-19 information page. If you click on this link, you'll go straight into the page that is updated regularly. At least once a week, there are new nuances that are put on and given. So the first thing that I talked about of uh, being listening to your local health department and the CDC. That's a key first step. Why are we listening? And, as we listening, we're listening for kind of three things. Uh, Basically, to determine whether or not there are overall requirements that are being done by the state governments and what those regulations are. Those are usually linked either through the state website or through the CDC. Then kind of going from the state level, going down to your local level, getting an understanding of what the local counties and the city or county public health authorities might have with regards to restrictions or notices of activities in the community. Because COVID is, while it is an equal opportunity infection, it's not an equal opportunity. It hasn't been equally distributed across the nation at the same time. So a local community may have a higher infection rate and may be doing some things that are more stringent from a restriction standpoint than another locale. And that's where you need to be getting good information. And then third, synthesizing the information from the state government, from your local community to determine which phase you actually are in your local community. Because there's not going to be any, or most communities are not going to post that you are in the USATF phase 1, 2, 3, 4, 5 of hosting. And so you're going to need to get that information, synthesize, and use the phased approach to understand what you can and cannot do, or should not do. Risk stratification. Again, the underlying message here is that there is nothing that we can do that will absolutely guarantee that you will not be infected with this virus. So what we have to take, on the mindset that we have to be in, is, are we able to decrease the risk and make sure that you are at as low risk as possible for infection with your activities. And here, what USATF did is we used the USOPC infection transmission risk stratification scale. Low risk are, and we're diving into track and field events here clearly, shot put, discus, high jump, triple jump. Here, the using the basic social distancing guidelines for all athletes and all officials. Long jump, triple jump, again, the social distancing and potentially accommodating for video assistance with fair and foul calls, because that comes up against social distancing. The high jump, pole vault gets into a little bit of a more tricky situation, because it is there is the issue with the mat or the tarp that has to be cleansed, and figuring out how you would do that either in between each jumper, or how you would modify the way in which you have that event take place. Sprints and hurdles are pretty straightforward. It's about using the different lanes in a different way. People are normally staggered, and then the blocks would need to be disinfected after each use, after each phase, after each heat. again, the typical basket being brought to the start and finish line would not be able to be done. So accommodations would have to be made there. Now, for road races, race walks, and the mountain ultra and trail events, here, the thought of staggering the start is going to be great to provide social distancing, and the use it on the course as you're able to in areas that and try to make sure that the course does not have areas that narrow down to closer than 6 foot, so that people can maintain that distancing as they're going through and having a safe passing. If you notice that the recommendations that they have in there, none of the recommendations had athletes continuing to wear masks during their competition. I will, and when I close in the last part of my presentation, I'll talk to how or why we thought about that. Moderate risk, again, pole vault and high jump kind of straddle between low and moderate risk. The throws events, you are able to do the social distancing. The common pool of implements is going to be kind of tough because you want to be very cognizant of the implement sharing. There should be having the one specific person retrieving the implement, and special attention being paid to that process to make sure that there is disinfecting and sanitizing going on after the event. And these recommendations that we're talking about, again, going back to trying to stratify risk, it's trying to decrease the likelihood that you will have infection spread. And these recommendations are based on common public health guidelines and recommendations for generalized decreasing the spread of, or generally decreasing the spread of airborne illnesses and infections like COVID. With the hurdles event, if any adjacent, again, talking about the adjacent lanes being used, the ideal would be to use every other lane, but if you are using adjacent lanes, that puts you into the moderate risk category. And then for the middle distance races on an 800-meter track, that again puts you in that moderate risk range. And then the road races where they're not able to maintain the minimum 6 foot passing range, that puts you into a moderate risk stratification. While as we talk, we'll be talking about a lot of things that we can't do, a lot of things that we have to be careful of, a lot of things that we are concerned about. One great thing is that when we're talking about high risk, none of the normally executed track and field, road race, and ultra type events are stratified as high risk. And so low and moderate risk allows us to have some good flexibility and some good insight in getting back to doing our competitions in a safe and healthy manner, in as safe and healthy manner as we can. All right, so once we've gotten that risk stratification of the event, understanding whether it's low or moderate risk, we can then talk about the phased approach. We looked at 5 different phases where Um, Phase one was when you're required to shelter in place. Phase two is when you've lifted, but um, uh, there is a prohibition on a large group activities. And we mentioned we cut the level of a large group activities at 10 um, uh, um, or less. And then phase three, phase four, phase five are as you see them there. And again, each phase is subsequently allowing a little bit more freedom, a little less a restriction, but still then has to be seen in the context of what are the risk factors or what is the risk stratification of the activity that you are doing. So with phase one and phase two, as we talked about, the phase one is sheltering in place. Phase two is the shelter in place requirements, but you have they have some prohibited group activities. Here, you are not able to do any USATF sanctioned event. Okay, you can have an event, but USATF won't be able to sanction that event as a part of that. If you have moved out of the phase one or phase two and you've gotten a sanction, know that if it moves back into a phase one or two by the day of the event, the USATF sanction will be removed or revoked. So you have to have that sanctioning. You have to have the phase level maintained at a greater than 3 or above at the time that you request sanction, as well as at the time of the event taking off. Phase three, where you are able to have small groups, typically 10 or less, but public training locations remain closed. Here is where the micro events consisting of 10 or less people, including officials, could potentially be sanctioned. Again, provided that the risk stratification measures are taken into account and accounted for as to how you're preparing. The ways in which you can do this is having separate sessions that can be scheduled at the same facility, as long as you're trying to still keep that less than 10 individuals in the facility at any one time. And all the events must meet that low risk stratification that we talked about. So the moderate risk of, if you're going to have sprints and hurdles, they would need to be in a alternating lane. They would not need to, they could not be in adjacent lanes from that standpoint. So again, as we look at the staging that we're located in, that gives us the flexibility or the parameters around which we can proceed. And then once we have the parameters around which we can proceed, you then have to go to the low risk or to the risk stratification to make sure that you are proceeding in a way and following the recommendations and guidelines for decreasing the risk of spread. Phase, go ahead.
2-minute warning.
Okay. The phase 4 and 5 here are when we're getting back into when we're into the area where we have a vaccine or we are been allowed to open. We will be able to be going back to the normal USATF considered for normal competition can be considered, but again, we got to determine that risk stratification, moderate and low risk will now be able to be incorporated. kind of my closing points, as Dr. Kim alluded to, this pandemic is very shifty. We don't know where it's going. We're just now getting information back on how people have been able to accommodate and do things as they've gotten back out to their activity. So we still have to be cautious and wary and patient, understanding that recommendations and indications might change. You got to stay informed. The local health department is probably going to be the key to helping you understand which way or what you can do. And then USATF and your conference or association rules and guidelines will help you to know how you can do what you can do. And then kind of the third thing is stay safe in general. Wearing of a mask, using the social distancing, increasing hand hygiene, all of those things are things that will translate into how you're able to, or should be translated into how you are able to put on these events and move forward. So on that note, I wanted to say thank you for listening and open up for any questions on that kind of brief overview of the USATF guidelines.
If you have any questions for Dr. Mason, you can put it in the Q&A function, Q&A box at the bottom of your screen. All right.
No?
Nope, we don't have any questions coming
Oh,
through.
good.
Thank you,
Great.
Dr. Mason.
No problem. I would kind of transitioning from there, I would like to introduce one of our additional sports medicine providers, Dr. Courtney Gleason. She's going to be doing her talk on return to running in the age of COVID. Dr. Gleason, as I said, is one of the non-operative sports medicine physicians here at Emory in the Department of Orthopedics, and she has cross-credentialing in the Department of Pediatrics. She is the director of Emory's Female Athlete Program. She is also the head physician for Agnes Scott College and the team physician for the Atlanta Dream. She also serves as a physician for the Atlanta Ballet and is one of our running medicine specialists here at Emory. She has traveled internationally with USA Soccer and served as the crew chief for the Peachtree Road Race for the past 3 years and provides finish line coverage at the Publix Marathon and Half Marathon every year. She enjoys treating runners and aesthetic athletes with special clinical interests, including overuse injuries, bone stress injuries, and she has recently started a multidisciplinary bone stress injury clinic here at Emory. Without further ado, I'd like to welcome Dr. Courtney Gleason in to give us a talk on returning to running in the age of COVID. Courtney?
Good morning, everyone. Thank you, Amadeus, and thank you both to Dr. Sarah Reiser and Amadeus for putting on this conference. I've learned a ton, and it's really a pleasure to be a part of it. I am going to talk today on return to run in the age of COVID. So let me get my screen shared here and we will get rolling. All right. I have no disclosures. So I wanted to start today by talking a little bit about the popularity of running in the US. In 2016, we have some data coming out from that showing that there were about 17 million race finishers in the US. Breaking down the demographics, about 57% of these were female, totaling close to 10 million, and about 43% were male, just over 7 million. Looking at these demographics, about 50% of these race finishers were between the ages of 25 and 44 years old. The bar graph here shows, again, over about a 25-year period, the trends and the increased popularity of running. So a gradual increase to a peak to about 2013, and then we've seen numbers leveling off in 2015 and 2016 to about that 17 million mark. And looking at some data that's coming out for the last few years, looks like things are pretty steady. It'll be interesting to see what happens with COVID and with numbers, with how many people are participating and staying active in the running community, because certainly we've seen an increase in all levels of running as the pandemic has gone on. We had about 30,000 running events in the US in 2016. The most popular distance is 5Ks. So about half the finishers were running 5Ks, 10% were running half marathons, and about 7% running 10Ks. So why do people run? Everybody has their own individual reasons for running. So generally speaking, we see a lot of people running to get in shape or stay in shape. It's a good way to reduce stress, endorphins, camaraderie, community. But now we have the additional component of COVID, and that actually has contributed and increased our running population a good bit. There was a survey sent out by ASICS this past year, and it surveyed 14,000 regular exercisers, and this was actually a global survey. And so over a third of those who responded to the survey, individuals who were active and regularly exercised prior to the onset of the pandemic, responded that they were after the pandemic started, that they were actually exercising more. There was data from a fitness app, so data looking from April of 2020 that showed that there was a 252% rise in registration for this particular fitness app, a 44% increase in monthly active users compared to the same time last year. And there was a 62% spike globally in people going out for a weekly run. So obviously people are using exercise and running as a way to boost their physical and mental well-being during the COVID pandemic. It's a good stress reducer, prevents weight gain, boosts the immune system, and improves sleep. But it's also very important to remember the need to avoid injury and avoid illness. So as the information's coming out from the ASIC survey and from the fitness app showing that there's an increase in exercising and an increase in running, anecdotally, I would say that probably a lot of the people who see sports medicine patients in clinic probably saw an increase in certain types of injuries early in the pandemic. And one thing that I definitely noticed was an increase in specifically bone stress injuries and overuse injuries of that type. I've actually included a couple MRI images just to give you an idea of what that looks like. So I'm going to go through those really quickly just on a couple patients that I saw. So this is the tibia, the lower leg, and you can see here, this is what it looks like typically, that dark area on this type of image. And you can see here, hold on, I've lost my cursor. There it is. Okay, hold on. Okay. So you can see here, this light image is the area of bone stress. And so this is a little different view, and that shows you that's the marrow inside the bone with that increased stress in the bone. And then this was another woman who had markedly increased her running. So this is a couple of views of the ankle on MRI. And again, I'm trying to find my cursor here. So this is the fracture, and you can see all of this edema here in the bone around it. This is what the bone would typically look like. And so interestingly, we were seeing a lot of this. And so thinking about how do people kind of enjoy the benefits of running, all that brings, both physical and mental benefits of running and exercise, but avoiding those types of injuries. And then also the extreme importance of avoiding illness. So getting started. Before you get back to running, you really want to identify what your personal goals are. So do you have a mileage that you want to achieve every week? Do you have a certain number of days that you'd like to run? Do you have, time that you'd like to achieve? Is it a race that you'd like to do? Would you like to do the Peachtree? Would you like to do the Publix half marathon? And recognizing that, maybe it'll start as one goal, but then evolve as you're getting into it more, and maybe those goals will change a little bit. But the importance of identifying a goal so that you can kind of backtrack from that and set up a program ahead of that to help prevent those sorts of injuries that we were seeing early in the pandemic. The American Heart Association recommends that adults get about between 150 and 300 minutes of moderate intensity physical activity, or at least 75 minutes of vigorous intensity physical activity per week. So when you are starting to consider kind of getting back into running, you want to really make sure that you have a baseline level of health so that you're not putting yourself at risk for other problems with getting back to running. So that's kind of a big thing to ensure. And then there are lots and lots of different kind of formal training regimens that you can follow. And so if you choose one of those to follow, then really recognize, so usually those are kind of organized in a weekly fashion. So, for certain races, it may be weeks 1 through 8. And so you want to recognize that week 1, that program may assume that you're doing some sort of baseline running. So you just want to make sure, if you are just starting and you haven't been running, I saw some patients in clinic, who hadn't really run for 20 years. They ran a ton in college and they remembered, oh, I could do this mileage in college, so I'm just going to kind of get back to it because I have more time. I'm at home. It's nice to get out. But recognizing that if these programs are set up at week 1, assuming that you're at a kind of a baseline, you may have to add a few weeks ahead of that, kind of before you get to week 1, where you can kind of get some baseline in so that you can safely follow that regimen. So kind of, again, general rules, running between 2 and 4 days a week helps most runners achieve their goals. A lot of the training programs will have days, 3 or 4 days of running. You want to make sure that you have rest days. Again, thinking about why people get stress injuries and overuse injuries, a lot of times it's because of a lack of rest or a lack of cross training. So making sure that there are those rest days that are just a regular part of the program. And then you want to incorporate cross training. So cycling, swimming, rowing, all of these are super helpful for kind of helping you continue to build your cardio, but they're giving you a break from the high impact running. So you're getting a lot of the benefit and helping you kind of advance your goals with running without increasing your risk of overuse injury. And weightlifting can be actually a helpful part of this too. So this is just an example, but I put it in here just to kind of highlight a few points. So number 1, this program is for a 5K training. You can find thousands of kind of programs. So this is just to highlight a few points. You want, 3 or 4 days of running. You want some days off or a day off, and then you want some days of cross training. And then the other thing to note is you want to have an incremental increase. So you'll notice here minutes just incrementally increasing as you go forward through the training, and then mileage incrementally increasing. So those are all things to think about when you think about what are risk factors for overuse injuries that we're trying to avoid so that you can safely achieve your goals. So certainly talking about injury prevention as you're getting back to running is one of the mainstays of what we're trying to accomplish. But with COVID is also the added element of illness and staying well. So as Amadeus was talking about, Dr. Mason was talking about, this is an evolving sort of science and situation. So what we can talk about now is kind of what we know, but certainly paying close attention to the local health department, CDC, kind of up to date on those guidelines is going to be super important also. So as we've heard in talks already this morning, running while social distancing, and there's been some talk about kind of the aerodynamics with fast running or walking. Fast walking or running. And so some places you'll look, they'll say increase your distance for fast walking or running. And some of them talk about 5 meters or 10 meters. Again, this is an evolving science, but that has been some discussion. And then again, as Amadeus talked about with some of the other regulations, you want to maintain 6 feet with people that you're running, kind of staggered side-by-side arrangements. Families can run together. If somebody is coming towards you in a more, not in a formal sort of fashion, but you're outside running, you want to really move over and allow for that 6 feet of distance to make room for others. And then from a safety standpoint, really consider running just with one other individual where you can easily maintain social distancing, or running alone. And then again, the considerations for masks while running. And a lot of this depends on a number of things. Local health departments and any sort of mandates and regulations from the kind of government side of things. But also if you're in a very crowded, like a more crowded area, or if sometimes people are indoors. And so those are all things that may impact this decision. And so in the event that you're wearing a mask, wearing something that's best for you, that some masks are a little bit more breathable than others. So kind of maybe trying out a couple different ones and see what works best for you. So again, to reiterate, we are still learning more about COVID, evolving situation, but certainly running has increased kind of anecdotally in popularity, it seems. And so kind of the big thing of staying injury-free and staying illness-free, so that there's an opportunity to really appreciate the physical and mental health benefits of running. Following that gradual return to running program, you can really individualize it to your own goals. And then the kind of just the concept of social distancing and staying safe to keep yourself safe and healthy, and keep others around you safe and healthy as well. More than anything, enjoy it and have fun.
Thank you, Dr. Gleason. All right. We have a question. How likely do you think it is that transmission is occurring when you pass someone outdoors when running?
I think that's a very good question. And I wish that I knew the answer. I don't know. I don't know if any of the other panelists have an idea, but I am not sure. I think that a lot of it really depends on the social distancing. I think that's why they kind of really reiterate the importance, even when you're outside. I think sometimes people get a sense of, oh, outside kind of open air. There's still the importance of maintaining that six feet of distance to really minimize the chances of that transmission happening. So I hope that's helpful, but I would say more than anything, just kind of the importance of recognizing to keep that distance, even when you're outside.
Got it. All right, perfect. Are there any other questions? All righty. Thank you, Dr. Gleason. Good information.
Thank you.
Thank you, Courtney. That was awesome. So kind of transitioning to our next speaker. Again, the dichotomy of this session is the second half of the talks are supposed to be focused on real practical things that you can do today and apply today, and give you advice on how to practically do things. And one person who our next speaker, Dr. Josh Glass, is all about the practical. He has a wealth of experience, but also has a lot of exposure to athletes, and has been very good at melding the experience, the exposure, the knowledge, and is very evidence and practice based in what he does. The interesting thing is that he is actually practicing now, in that he was scheduled to be live speaking with us, but he's actually out and working with the Georgia track and field team, and so was only able to give us a video presentation, but nonetheless, it still should be very informative and very practically based and experientially based. So Dr. Josh Glass is a sports chiropractor at Georgia Sports Chiropractic. He works with runners, walkers of all levels, and has been practicing in Atlanta since 2001. He's actually been living in Atlanta since 1984 and started running with the Atlanta Track Club in 1986. He competed for Wheeler High School and at UGA on the track and field team. And he currently serves as the team chiropractor for the Atlanta Hawks, Emory and Georgia State's athletic departments, UGA and Georgia Tech's track and field team. He has been the part of the medical team for more than 12 USATF national teams, including the 2012 London Olympics, the 2016 Olympics, and hopefully will be joining us in 2021 at the Tokyo Olympic Games as well. He continues to run most days, and you might be able to see him out on the Chattahoochee Trail if you look very carefully. So without further ado, I will give you the recorded Dr. Josh Glass.
Can you please confirm you can hear the audio?
Hi guys, Dr. Josh Glass here. I'm the owner of Georgia Sports Chiropractic in Atlanta, and I am happy to be talking to you about my own personal experiences as a sports chiropractor and as a runner, as far as going to events, working at events, participating in events during these COVID-19 times. These are all my own personal opinions and experiences. I don't have any slides today. I just want to tell you exactly what I've found and what I've learned and gained from these experiences, and hopefully we add it to the collective knowledge of how to navigate things. I do not claim to have all the answers. I am not going to cite you specific research studies. The CDC does an amazing job of that. National Health Institute does an amazing job of that. But I want to tell you about what I've accomplished. And when Dr. Mason asked me to be part of the conference, which I greatly appreciate, that was what he requested, was to relate what I've done. I, first and foremost, am a runner myself. I did my first 5K when I was 10. And so in 1986, I did my first Peachtree Road Race. I competed for the University of Georgia. And now I still run, but mostly I take care of runners. I work with runners of all levels, beginners, people just being active, up to professional Olympic level. I've been with the U.S. Olympic track and field team the last 2 Olympics, and then we'll be going to Tokyo in 2021. So I like running. I love helping other people do it. So this is another big hurdle we've all been trying to deal with is running during COVID. I'll say personally, I had one of my best running streaks when it all started and wasn't really working and could sleep in every day. I mean, March, April, May, I don't think I missed a day of running. I haven't done that in a long time. I live near trails where I could go out and be socially distanced, not see another person, not have to worry about running with a mask, and that was great. But really much nothing else has been great about it. You know, the part that was interesting for me was navigating what do I do with taking care of runners. And first it was figuring out what to do in my office. And I'll only speak for myself, but as a healthcare provider, it was really challenging because we weren't given absolute definitive advice, especially when you're a practitioner that owns your own practice and is the bottom line for deciding what to do. We had, you know, advice from our national governing bodies. We had guidelines that the state allowed, county, the city. But in the end, with talking with other healthcare providers, learned how to provide care for people safely. And for us, it was getting rid of our waiting room, putting up plexiglass, masks mandatory at all times for the practitioners and the patients, temperature checks. And it's actually gone really well considering that we have a very safe environment, we have had no challenges, and are able to take care of everyone that needs it, that wants to come in. And the first thing we learned was not everybody wants to come in, and that's fine. You know, telemedicine's been a good thing, and I've always been happy to get on the phone or a video conference to give a runner advice. I mean, I have made my living being a running specialist, being able to help look at someone's running biomechanics and figure out what's not good and how to correct it. So we've been able to keep doing that. Now, your own office is one thing, and your own home is one thing, because you make all the rules there. It's when you venture out that it gets really interesting. And the one, bit of advice that I'll give, everybody with running outside, going to do a road race, going to volunteer at a race or an event, going to watch an event, know your own rules. That you have to. You can't control anybody else, but you can control yourself and what you do. And so for me, the first event that I did was the Atlanta Track Club return of the duel. And the Atlanta Track Club did an amazing job. They put up so much work to do this. And it was a virtual track meet with their runners doing a distance, and at the same time outside Eugene, Oregon, the Oregon Track Club athletes doing the same distance. Their rules were great. You only a certain amount of people were allowed in the track. Everybody other than the runners competing had to have a mask on. There was an area for me to work on the runners where everyone was masked. Hand sanitizer everywhere. And for me, it was a great way to go to an event and have it be well run, well thought out, well enforced, and safe for everybody. So that was a good kind of return to helping athletes at events, which is what I love to do. I mean, I'm in my office 5 days a week, but I love to help. I like to be at the track. I love to be trackside, helping athletes compete better and recover better. So that was the first one. The second group of events I did was much, much different. We had the American Track League in Atlanta, Georgia. And this was a great thing to happen. It was a chance for our our Olympic level track and field athletes to get competition, and they needed it to keep their progress going towards the now 2021 games, but they also needed to keep their professional contract and be able to put food on the table. So at any rate, the American Track League was a series of races at Life University in Marietta, Georgia. And there was youth events during the day, and in the evening there was events for open and mostly professional. We had more of our Olympic track athletes competing here than anything else that happened during COVID. We had so many of our medalists and even top athletes from other countries. And so it was a great opportunity for the athletes, and they really appreciated it. And, at least something that I've come to learn here is we can all have our own personal thoughts about how you should or shouldn't do things during COVID. And, should you run? Should you rest? Should you compete? Should you not compete? But in the end, if athletes that are making their living, that it's their dream and their passion to compete for their country in the Olympic Games, need to compete and are going to compete, then I feel we have to find the best way to support them and allow them to do it. And so that's what the American Track League was, because there were not the same rules and regulations in place. There was some temperature checks. There was no required or mandatory COVID tests for the athletes competing. So again, I'm going to this event knowing full well that the athletes are competing without masks. I know that we're going to do temperature checks on the track. I know that we are going to have a full, meet going on. And I'm going to take care of athletes that I have a relationship with, have treated in the past and know from professional track circuit and Olympics. But I had to make my own rules. And so for me, it was going in there and it was absolutely, I am going to wear a mask from when I step out of my car until I get back in it. And no one is going to get on my table without wearing a mask. And that, it's easy to say this, but then when you have 3 Olympic athletes lined up and one of them doesn't have a mask, you have to say, you don't get on my table without a mask. And I even found myself stepping up for practitioners, and they were set up 20 feet away when I see a big group of athletes talking around them, because the athletes, they want to follow rules. They want to do the right thing, but they're not running in a mask. And so how quickly can they get that mask and put it back on? It depends. They're on their own. So that was number one for me. I'm in a mask. I'm not taking care of anybody without a mask. Hand sanitizer galore. I had great little ones made up with my office logo. I had big things of it. We're using a lot of hand sanitizer. And given the not great amount of planning that went into it, it still came off really well, and there were no problems that I know of. I did about, I think, 9 of the 11 meets, and the athletes really appreciated it. And they appreciated being able to compete. They appreciated being able to get taken care of. They appreciated having a season, and so it was worth it. It was worth it to help our athletes be able to continue what they were trying to do. The next event I did, the Atlanta Track Club did a second meet. And this one was an actual meet, and they did competition with runners from around the country. And I believe the rules for this one were that the athletes had to have at least, I think, 2 negative tests that week and had have quarantined, stayed away from other people. And so it was, again, really well run, really well enforced. So a safe environment to work on people. And, again, when I went in there, I knew my rules. I knew that I was going to wear a mask. I knew I was going to take care of anybody without wearing a mask. And I knew I was going to sanitize the heck out of my table between every patient and wash my hands and sanitize them between every patient. And that's what I could control. And again, went really well. Now, I am used to being at events all the time and going all over the place. This is the longest, I'm sure, like most people, that I haven't flown. I had opportunities to go to work at Diamond League meets in Europe. I had a number of athletes saying, please come with me. We need you. Will you help us out? And this is one of the first times I said no, because when I looked at my rules, but then what it would take to fly internationally, the requirements for testing, the possibility of long quarantines, it wasn't, for me, that I was not willing to take that risk of not being able to control the situation enough and the scenario enough that maybe I couldn't get back to my family and patients. So I didn't go with some of our athletes, and they all did great and came back, better for it. And I applaud that they were that dedicated and that focused, that their agents got them there and their sponsors supported them, and they were able to have a season and have some more stepping blocks towards Tokyo. Starting to do more now. I'm a team chiropractor for both Georgia Tech and the University of Georgia Track and Field. I've been seeing Georgia Tech athletes in my office. Again, where I control the rules and the athletes know to wear a mask, I know that they're being tested on a weekly basis, which helps a lot. I'm being tested on a weekly basis. So the more of these checks, these safeguards that you can take, the better you feel. And that's really, to me, what it's about, is being as safe as we can and planning as much as we can. I started going back to the University of Georgia about a month ago and working with their athletes. I get tested as soon as I arrive, then start working on them after the test comes back. And that's been great for me to get back. But in that scenario, they have an amazing sports medicine staff that's controlling everything. And so no athletes, they're controlling all the athletes to get to me. Nobody's hanging out in big groups. It's just me and an athlete. And again, my rules apply, and that's worked well. I'm a team chiropractor for the Atlanta Hawks, and I have not been in the facility since March, when they were the first of the professional leagues to shut down. And I've been told that we got a start date for the season, and I'll be able to start going back. But they initially, I believe this was league-wide, that I'm considered a contractor, not a full-time employee. That no contractors were allowed in any NBA facilities. So I'm certainly looking forward to getting back as the season gets going, and taking care of these athletes. So those were my experiences during COVID. I think everybody's had their own. I've kept running myself, and it is, I'm lucky to be in an area where I can easily distance, but you're going to pass somebody on the trail or on the road. I just give a wide berth across the street if I can. And certainly it's not a time to socialize. But it's awkward moments that nobody can prepare you for and you can plan for. You just, again, have your rules of what you do. Because I don't know about everybody else, but for me, running is my medicine. Running is my stress relief. Running is the part of my day that I want to make happen whenever I possibly can. And so we are lucky that we were able to run. Everyone's been able to hopefully figure out a way to do it safely. And you look at other sports, My wife works for the USOPC as a sports dietitian, so she works with track and field and swimming. And so she's seen, the big differences you can hear. Swimming pools were all shut down, so you have these Olympic swimmers that never take a day off. That they suddenly had no pool to train in, and they had to find ways to cross train. So I am grateful that my chosen form of activity is accessible, but the events part is just, each of them is their own separate scenario. The Atlanta Track Club has done a great job. I feel like their staff has just worked so hard and thought through every detail to put on, high school cross country meets and Atlanta 10 miler, but it is not the same, and it's hard, and you have to make sure you're comfortable with going to an event and being okay with people around you, even if you are 6 feet different. But each person figures out what makes the most sense for them. Now, again, I don't have any slides. This is I like to have discussions. Unfortunately, in this format, I'm not going to be able to take questions, but I am happy to answer any questions. I can be reached in my office. My email is runglass, RUNGLASS @gmail, and I'm happy to answer any questions. But I think you've got some of the best leading experts associated with Emory and part of this this conference that you're listening to. I think you're going to get a lot of great information. And my message to all of you is make sure you know your rules when you step out the door, whether it's to go on a run, whether it's to run or participate in an event, whether it's a volunteer event or watch an event. We've got vaccines that are coming, and ideally things are going to get more back to normal slowly and surely, but you've got to know your rules so that you can be comfortable and safe with the scenarios that you encounter. The interesting thing for me professionally that I've dealt with runners is I'm doing right now what I tell everyone not to do. I'm sitting, because I mostly don't sit at all. I'm up all day. So many people that are runners have had issues because they left their office where they had an ergonomic workspace, a standing workstation, and now they're at the kitchen table or the couch. And that might be okay for a day, but when you do it for weeks and months, the postural issues that happen are not good. And a lot of times you'll feel that with your running. So I'm certainly advising my patients and anybody especially that's in a runner, is first of all, get in the best position you can. Standing is better than sitting. My legs are just tired from a long day and I got a good run in. I want everyone to stand that can. I want you to do range of motion drills. I want you to do leg swings. I want you to stretch your hip flexors and your chest. You got to do stuff to recover from bad posture and working these long hours in a different setup, or else it will end up giving you a running injury. So often when someone comes in, it's the common running injuries of IT band or hamstring, Achilles. Take your pick of overuse injuries. But the origin of the injury happens from their work posture, because unfortunately we all work a whole lot more than we run. We have a bad adaptation to work posture, and it affects our running biomechanics. So yeah, you got to fix the running biomechanics, and that's done with hands-on treatment and then the appropriate exercise that everyone can do on their own. But you gotta fix the posture. So a little bit of a tangent there, but I think it relates to COVID and it relates to running. So what I want more than anything is everyone to keep running, stay healthy, get after it. Look forward to any questions you guys email me. Thanks again for your time.
Well, I think that was kind of right on point and very timely. I thanked Dr. Glass electronically for his presentation. Really timely, really poignant, and kind of gives us a nice transition to how we're going to close our conference. The last presentation is going to be a panel discussion with the folks from the Atlanta Track Club. We have, as I mentioned before, developed this medical coverage partnership with the Atlanta Track Club and event coverage partnership with them over the past couple of years. And we wanted to leverage that because when you're talking about running and you're talking about that in the Atlanta community, you cannot do that without talking about the Atlanta Track Club. And as a running medicine conference, it would be remiss to not tap into that wealth of knowledge that and experience that we have ready access to. And so what we would want to do is have this panel discussion with 4 members from the Atlanta Track Club: Rich Kinal, Lisa Tanner, Amy Bagley, and Yolanda. And I am not going to attempt to pronounce the last name because I know I will butcher that. And they are going to respond to questions that we have from you and from the audience, and hopefully give us some insights on what is going on with the track club and what is going on and what we're doing now and what their experience has been with COVID. Rich has been blessed to travel and race in more than 30 countries. He has lost the vast majority of those races, including his road race debut where he finished dead last. But Rich is a true believer in the power of this sport and its ability to change the direction of people's lives. Although the executive director, he recognizes that there's only one boss. He's definitely a guy from Jersey, but he is one who was also born to run. With Lisa Tanner, she ran track at the University of Georgia. She was a high jumper. Her first full-time job was with the Atlanta Olympics, where she worked for close to 2 years and was lucky enough to get to work on the team responsible for athletics, that is track and field competition. She's married and has 2 children, a son and a daughter. Amy is an animal lover. Amy's favorite moment is when she got to hold a panda in China. It was a gift to herself for making the 2008 Olympics team in Beijing in the 10K. Even though she is a distance runner, in her first master's track and field meet, she tried to long jump, discus, shot put, 4x1 and 4x4 relays. Her favorite was the long jump, and Amy splits her time on the job with the in-training programs and the elite team. In her spare time, she volunteers at Best Friends Atlanta Adoption Center. And finally, Yolanda is a track and field athlete from the Atlanta Track Club Elite. She's a Swedish national record holder in the indoor mile and a semifinalist in the 1500 at the 2019 World Championships. Without further ado, I'd like to have you or transfer to Janine Holmes and Rich, Lisa, Amy, and Yolanda for our closing panel discussion.
Right. Thank you, Dr. Mason. We're super excited to have you all here. So our first question, from an organizational standpoint, what are some adjustments that the Atlanta Track Club has had to make due to the COVID pandemic? And that question could be for anyone.
I'll jump in if you don't mind, Janine. I'll start by thanking you and Dr. Mason and Dr. Reiser and everyone at Emory for welcoming us to this panel. The high level challenge that we face at the Track Club is that our mission is largely accomplished by bringing people together, and obviously that ability stopped in mid-March of this year. So as an organization, we had to pivot in the early spring and then into the summer months, from being an event and program driven organization where we bring people together to exercise, to a content-driven organization, meaning giving people the tools to do that running and walking on their own. And that was a big challenge for us, but very proud of the organization and the efforts that we made bringing what we call just a microsite associated with our website to the running community here in Atlanta that we like to call Running City USA, and that is called The Distance. So if you look for The Distance, Atlanta Track Club, you'll find a lot of content generated by the track club this year.
Are there any good changes that you had to make that you're thinking of implementing long term, or even after the pandemic is over, that you feel like would still stay around?
For the training programs, we did a lot more virtual. We used to do these panels after the participants finished, and we realized nobody wanted to stick around after, an 18-mile marathon training run, right? So now we do Tuesday nights educational sessions via Zoom, and I actually think the participants are getting more out of those sessions because they aren't tired, they aren't sweaty, they don't, they aren't ready to go home. They are at home and they can actually absorb the information. So we are going to continue that one actually after this. It's all over. So we'll continue the online version.
Nice. What operational changes have you had to make to certain competitions, such as the Wingfoot cross country meet?
So I think the biggest challenge for us is Atlanta Track Club feels such a huge sense of responsibility to still deliver on our mission and deliver in our events and program to the community. So we spent an extensive amount of time evaluating every facet and every aspect of the event. How can we alter it? How can we make it safe? It's kind of interesting. The experience of the participant is always a lens that we go through when making decisions. And now safety is that lens that we use. And we have just peeled back every part of an event or a program and come up with the safest ways in which we can bring some sense of normalcy back to the running and walking community.
Nice. Were any of your community runners, were they involved with any of the changes that you had to make? Did you solicit some of their feedback in making those changes?
So we did a lot of research with other running organizations, other races, a ton of webinars were spent. Those first 3 months, I feel like that's all I was doing was trying to find a webinar to join. Just learning. Also, we have a race directors roundtable here in Atlanta where we bring all race directors together and we meet twice a year. So we've met also just to kind of discuss best practices. For us, the goal is to show the city, the counties, the United States, America, the world, that there are safe ways to bring people back together again. And it's our responsibility to kind of lead the way.
Nice.
If you don't mind, I'd love to follow up on that in terms of some of the things that Lisa and the events department brought to market this summer, and that was this race by appointment concept, where through the webinars and all the research that our staff did, we put together a plan that allowed our events department to start to put on events safely, and this pilot program started small, and we've scaled up from there. And for us, it's building confidence in the running community so that they know when they see Atlanta Track Club putting on an event, they know that safety will always be our first priority.
Nice. So a big emphasis on safety.
Very much so.
How do you feel that your athletes are adapting to some of the competition changes?
I think that's a great question for Yolanda.
I think personally, I feel like, since you don't have a choice as an athlete, you always have to adapt to anything. It's like part of mental training, I guess. So I think what we have done is we have more time trials. So that's when you just race against your teammates at practice, just to simulate some type of race environment. And just personally, I just hope that next year will be better. And then whatever opportunity you get, you try to use it as much as you can. You don't take anything for granted anymore.
It's true.
And as a follow-up to that, Lisa, can you speak to some of the feedback that we've gotten from the participants in our pilot programming in terms of how we did and what they looked for from us?
Definitely. It's interesting that the camaraderie was something people have missed desperately. You know, it's the competition, community, and camaraderie. Those are three pillars that organization lives by. And people are so appreciative to one for us to find a way to bring them together. We've established a health screening questionnaire that's a link and a QR code that everyone has to fill out within 24 hours of attending any of our events or programs, or even coming by the Atlanta Track Club office. So I think they feel that the Atlanta Track Club is supporting them, finding safe ways, finding ways to compete, finding ways to see a friendly face, and just, it's a silly phrase, but just establishing some sense of normalcy in a world that's not too normal right now.
This question is for Rich, and anyone can follow up. How is the Peachtree Road Race being changed this year to keep runners safe in the COVID pandemic?
So I'll try to give you a somewhat abbreviated answer. So when the world recognized and realized that this pandemic was starting to take hold in March, we were in the middle of our Peachtree registration period. And we had hoped, based on the projections that we saw, that a July 4th race would still be possible. So we registered well more than 40,000 people. But by the end of May, we recognized that that just was not going to be in the cards. So we pushed to an in-person event on Thanksgiving Day and began to plan for that in earnest. And then when we had the spikes in the southeast portion of the United States this summer, we recognized and realized that it just wasn't in the cards this year. So we're really proud of the fact that, again, we pivoted and we are bringing to the Peachtree faithful a virtual running of the AJC Peachtree Road Race, and that's going to take place next week. So from Thursday to Sunday, those 45,000 people who have registered will still get as authentic an experience as you possibly can through a few things. Number one, we are delivering that coveted Peachtree finisher shirt to everyone, to their front door. If they haven't gotten it, they will get it very soon. And through an app experience. So you will be able to hear the sounds and see the sights of Peachtree through an app experience and capture your result through some GPS technology. So we felt that since more than 40,000 people felt strongly enough about their Peachtree tradition that they registered during this crazy time, that we should go the extra mile to find a way to keep the Peachtree tradition alive. And we recognize that for some, a virtual race is not what they wanted, but we believe that it is the next best thing and look forward to hopefully a 2021 52nd running of the Peachtree.
That's awesome. When you first said virtual race, I was like, oh, how are they going to do that? But having the shirts delivered and the GPS and all of that sounds amazing. We have a question from our audience. It's a multi-part question, so we can split it up. How would you rank the following with regard to importance to the organization? So safety, member experience, customer service, and financial sustainability.
Safety, member experience,
customer service, and financial sustainability.
Well, I guess I would. It's a challenging question to answer. Safety, the first is easy. Safety is always our first priority. You don't get to be a 56-year-old organization without keeping safety at the front of everything that you do. From there, in a non-COVID world, I would put the financial sustainability of the organization at the bottom. But in a COVID world, that has forced us to make some decisions that we've never had to make before. So in a COVID world, I would say, for better or for worse, that falls second in line. But in a non-COVID world, it is always about member experience and customer service. So even in this year, when we have been inundated with questions, some of which we could answer, some of which we couldn't, about the impacts of COVID. I am very proud of the fact that every single inquiry that has come to this organization has been responded to either via email or via phone. And Amy is available 24/7 for people in our training programs who are looking for advice on how to deal with training on their own.
All right, perfect. What have you learned? I'll pose this question to Lisa and then we can share it with do some follow-ups. What have you learned in 2020 that you didn't know in 2019?
I thought I knew what adapting meant until 2020. I think what has just been more reinforced is the responsibility we have to the running and walking community, the faithful followers, members, volunteers that want to stick with us. Not that we've ever taken any of those people for granted, but it's just been inspiring to see the support they've shown our organization as we're working hard to just keep providing and serving.
Amy, what's your answer to that question? What have you learned 2020 that you didn't know in 2019?
The planning is important, but the athletes need a little bit more certainty than we were given. And so I guess for me, it was, yeah, they can adapt, but there is a point where you have to start giving them certainty. And so I think from now on in planning, we are going to be adaptable, like Yolanda said, but we also need to try to find some certainty for them in some things. It's hard to keep training when they don't know what's coming. There was a great article today posted about training with no finish line. It's harder sometimes to keep going with that same effort if you don't know where the end is. So that's one thing I learned that we definitely need to continue to figure out for the athletes is a little more certainty.
Yeah. I'll ask Yolanda and then we'll finish up with Rich, the same question.
Yeah, kind of what Coach Amy was saying, because as an athlete, you want to adapt because, anything can happen on race day, or, you never know if it's going to be a windy day at the track when you race. So you try to always be adaptable in general. But yeah, I thought the hardest part this year was, it's almost like you were training really hard, but you didn't know when to be that like extra sharp for that competition, because it might just pop up like 3 weeks later. So yeah, I never knew that racing could be this uncertain. So yeah, I never knew I would have to adapt this much ever in my life. But kind of like Coach Amy said, it's nice when you can just create some of your own certainty in the uncertainty. So whatever happens, okay, in 2 months, we're going to have a time trial, and just try to make it like a race experience. Yeah, kind of just create your own, create your own, I'm trying to think of the word. Like if there's no race coming up, well, then we'll create it at this point, and then we'll take our break like we usually do. Like you create your own season if there's no season. You just do it with your team.
Nice. Rich, what are your thoughts?
So my takeaway really maybe harkens back to what Dr. Gleason had said earlier. In all that is bad about this year and all of the impacts of COVID, there is a silver lining. When the world slows down, more people run and walk. And the track club is working very hard now to figure out how to keep all of these newfound runners and walkers moving as the world starts to move at its normal speed.
Nice. All right, perfect. I wanted to end on a positive note and go around and ask everyone, what are you looking forward to in 2021? And hopefully, once the pandemic is subsided, I won't say over, but has subsided and we can kind of come out of our holes. What are you looking forward to? We'll start with Amy.
Giving the athletes more opportunities and being able to, I guess, be a little better on the fly, trying to give them those opportunities, whether it's the time trials, whether it's going to races. But, hopefully the Olympic trials will happen in Eugene and we'll get to go to that really fun new stadium. And Yolanda's a little bit different. She runs for Sweden. So for her, the route to the Olympics is a little bit different, and we have to give her those opportunities to be able to prove those. So hopefully we'll be going to Tokyo in an interesting, safe, but different way than usual.
Nice, that would be awesome. Yolanda, what are you looking forward to in 2021?
I'm looking forward to, more opportunities to race. But I believe there will be more, because I feel like at the end of this year, there were more opportunities that started happening compared to the summer. And I also hope that the borders will open up so I can have like a European season as well, and just get into those really big meets where I can run fast. So that's what I hope for next year.
Nice. Rich, what are you looking forward to?
So I recognize that with every day that passes now, even though we are seeing significant spikes locally and nationally, we are closer to a vaccine. And I recognize that this is not going to be just a light switch. And I think this is what Dr. Fauci had said this week. It's not going to be a light switch turning back on. There's going to be a dial. And as we do that, I look forward to building confidence in the running community that coming and being part of the track club's programming, whether that be events or training programs, is safe. So bottom line, building confidence back in the running community so that by the end of 2021, our Thanksgiving Day race a year from now will feel like it did 2 years ago.
And Lisa, we'll finish with you.
I think for me, I'm just really excited about being able to execute in all facets at a higher level. We've had a lot of time to listen, learn, and plan, and it's just going to be great, kind of like Yolanda's training, to just really show what we can do and how we can come out of this bigger, better, and stronger.
Like that. There's no better way to.
I'll follow up with Lisa on that. I really do believe that, and again, talking about some of the stats that Dr. Gleason had thrown out there, that coming out of this pandemic, we will see a new running boom in Atlanta and around the country, and we hope to be a big part of that.
Nice. Nice. Well, we appreciate everyone taking the time and answering our questions. I just wanted to check the box, make sure there's nothing else from the audience. Nope. Well, we appreciate all your time that you've taken to answer our questions. Thank you.
Thanks for having us.
Yes. Thank you, guys, for your participation. What we have done here from an Emory Sports Medicine, Emory Running Medicine program standpoint could not have been done or executed without the support of the Atlanta Track Club, our being able to cover, our partnership with them, the way in which we work on the event coverage, the medical providing helps us to be able to practice even better. And yeah, they have done a masterful job of pivoting and managing and moving forward in this COVID time. So thank you again, Atlanta Track Club members. And looking at the time, this has brought us to the end of our conference. Really want to thank all of you who hung out to the end, and people who have come and gone, and those of you who will listen to the recorded versions. Thank you for all of your support and interaction. And just let you know that the Atlanta community and Emory Sports Medicine and Emory Running Medicine program are here to serve, are here to help, and are here to make sure that running stays safe and healthy in Atlanta and as far as we can touch and would want to do. And so I would like to turn over to my co-director, Dr. Reiser, for the final closing words. Sarah?
I want to say thank you again to everyone who spoke. So glad to have Atlanta Track Club involved with us. Dr. Mason has done a great job in coordinating with them. We're so excited to work with the elite team. Also, thank you to everyone who joined us. I know that it's Saturday morning and it's the week before Thanksgiving, so maybe a little challenging time. Unfortunately, the virtual aspect makes it a little bit easier, I think, but thank you so much for joining us. We had, on our last poll, we had about 50% of you were healthcare providers and about 30%, I think, are recreational runners. So very cool to have such good involvement with recreational runners and still having healthcare providers involved as well too. It's great to have such a wide range of folks joining us. I would also like you to know that we've got a national audience. So we've got folks from California that joined us, Virginia, Florida, all over the place. So it's been really great to have all of you involved in this short and sweet symposium that we've got going. Now, this is short and sweet, but we have more to come. So we're going to be putting out a newsletter pretty soon and potentially also having more of these sessions. I was very excited about the demand that we've had, the questions that came through, especially during kind of our basic running medicine talks too. So we'll try to meet some of that demand as we can in the future. So thank you for being involved. I'll have Janine put in the chat one more time, that runningmedicine@emoryhealthcare.org. That's the email that you can contact if you have an interest in getting either into one of our Emory running medicine clinics for an injury or healthcare concern, or if you have questions on getting involved with our kind of running centric program. So we're happy to get you hooked up with folks who are experienced with runners, from physical therapy to psychology to dietitians. I'm happy to do all that for you. And the last little bit that I wanted to mention too, so kind of reiterating, so we have multidisciplinary bone stress injury clinic. We do also have this female athlete program as well as this running medicine program. So in terms of our female athlete program, myself, Dr. Kit, who works down at Grady location, Dr. Abunadike, who works at our Smyrna location, and then Dr. Gleason, who's at our Dunwoody and Hawks locations, and myself up at the Johns Creek location. All of us actually specialize in seeing female runners as well. And that can extend from having overuse injuries for runners and other athletes, or having other issues. So concerns about fatigue, lost menstrual periods, those sorts of things that we are here to help. Those can be challenging things to find providers that understand those types of issues as well. And so hopefully we can either help ourselves or help you get where you need to go. So thank you again for joining us for this 2020 Emory Running Medicine Conference. We very much appreciate your attendance. If there's anything we can help with, feel free to reach out to our email, and hopefully we'll see you soon at a conference like this. Thank you all.
Stay safe, everybody.